afternoon, or good evening, and welcome to another HRO Today Educational Podcast. I'm Elliot Clark, the CEO of HRO Today. We publish HRO Today Magazine, HRO Today EMEA, and HRO Today APAC, as well as host the HRO Today forums and educational events held around the world, and we manage the HRO Today Association. Today, we're going to talk about the healthcare industry and some of the challenges that are unique to the healthcare industry. I'm thrilled to have as our guest Keith Bradley, and just a little bit about Keith. Keith is the president of Recruitment Solutions at AMN Healthcare. AMN, as you all know, is one of the leading providers of workforce services, including RPO, MSP, as well as recruitment and contingent staffing, and they specialize in the healthcare industry. Keith has been with AMN for about a year, and prior to that, 16 years with IBM Connexa. And I had the pleasure of actually working with Keith early in his career, and he learned a lot by ignoring my example. So, Keith, welcome to the podcast.
Thank you, Elliot. It's good to be here.
AMN is one of the most highly rated providers on our healthcare RPO Baker's dozen. Why don't you tell us a little bit about AMN Healthcare?
Elliot, AMN Healthcare, we are the leading provider in total talent solutions for healthcare organizations in the U.S. This includes areas like acute care hospitals, community health centers, clinics, physician practice groups, retail and urgent care centers, home healthcare facilities, schools, really any care setting you can think of, we're there. And by total talent solutions, we really mean total talent solutions. Our programs are across many areas. They include managed services, clinical and interim healthcare leaders. We're into temporary staffing, executive search, scheduling solutions, vendor management systems, recruitment process outsourcing, as you've already mentioned, predictive modeling, analytics, language interpretation services, revenue cycle solutions, credentialing, and a whole lot more. And we do all of this, Elliot, in addition to providing access to the most comprehensive network of healthcare professionals across every discipline: nursing, allied, physicians, and yes, leadership. Of course, I'd be remiss if I didn't mention that as a company, we're most proud of our commitment to fostering and maintaining a diverse team that reflects the communities we serve. This commitment to the inclusion of many different backgrounds, experiences, and perspectives is what really enables our innovation and leadership in the industry. Glad to be here with you today.
Well, thank you. And thank you for explaining that all to the audience, because it means you're the perfect person for me to ask this question of, because you guys have a finger in lots of different channels in the healthcare workforce management sector. Let's talk about a big problem. So in the healthcare sector, many of the systems, particularly the larger ones, have complained both pre-pandemic and during the pandemic about the cost of contingent labor, and particularly travel nursing costs. However, much of the cost of contingent labor is reactive to short-term needs. Full-time permanent staff is far less expensive. You guys are in both the permanent staffing and the contingent labor business, so you're aware of the numbers on that. But it seems like part of the problem may be an inability of these systems to develop accurate workforce plans. So is that the case, and is it that HR lacks the tools, or that hiring managers don't provide HR the data, or that no one has the time to do it right, or some or all the above?
You know, Elliot, I would say it's a bit of everything that you've just mentioned, although it's really less about the ability to do it. The problem is that most organizations today lack the tools and the resources to devote the time necessary to engage in effective workforce planning. When you look at HR teams around the country, they're just incredibly stressed with the challenges of turnover and recruitment that we're all well aware of. But it's really difficult to plan for the future when you're having trouble getting through the day. For organizations to succeed in this area, talent management, they got to have that expertise. They got to have the tools, and they got to have those resources to effectively plan. Then it's an ongoing exercise. This is not like an annual budgeting process that happens once a year. To be effective at workforce management, workforce planning, you got to set that plan, and then you have to monitor it on a daily, weekly, monthly, and quarterly basis. And this is where we come in. You know, having a partner like AMN Healthcare, it really makes all the difference. Our role in this space to monitor what's happening with our clients. We're constantly looking at their data and sharing insights with them and using that data to get ahead of the challenges. And that's key, is to not be reactive, but to be proactive so that we can pull the right levers, help you implement a much more cost-effective strategy that enhances your ability to sustainably deliver care.
In that sense, you said that HR doesn't have the tools. Is it that there's been an underinvestment in it, or is it that the data is not available? I'm trying to understand if contingent labor is so expensive, and I'm not saying there isn't a place for it when you're dealing with variable caseloads, variable patient volumes, but if it's that expensive that it was the source of that much aggravation, you would think that you try to avoid unnecessary contingent labor. But this word workforce planning, this term, for example, with your clients, does AMN Healthcare help the systems develop better workforce plans? Because that seems to be part of that crisis mode that everyone's too busy to, address the underlying problems. Can they do it through partners? Is there software? How do they get better at it?
There's a lot that you just asked in that question. And
I know.
I think over the last couple of years, the pressure has been so high that it's been, hire at all costs. And temporary and contingent labor is the easy solution there. And in addition to that, the data and the technology, the data's always been there, but nobody's known what to do with it. And the technology is evolving so quickly that it's almost a full-time job to stay on top of the latest and the greatest in this technology. And then you factor in artificial intelligence and predictive analytics, and it requires a unique specialty to corral all of this and develop an effective workforce plan. And that's where, again, a partner like AMN comes into play, because that's what we do. We live, eat, breathe, sleep this on a daily basis. We're experts in it. We have consultants in it where, the healthcare systems around the country can't afford to build all of this out without help.
It is interesting. I had an occasion to just recently review a study we did a few years ago on investment in HR by the healthcare sector. And in that study, which is about 5 years old now, we were able to show a correlation between financial success and investment in HR. Very simply, for critical care centers, it's about census. If you don't have enough nurses to maintain your patient-to-nurse ratios, you're going to have empty beds, and you're going to pay for that overhead, but not get the revenue from filling them. So it is interesting. Internally, these chief HR officers, chief people officers in the healthcare sector have been trying for years to free up the funding to get some of the tools that you guys just use on a daily basis. For the benefit of our audience, who are healthcare HR people and maybe from other sectors, related sectors, how do they get the quick wins? Like, how can you show them, if you let us help you, this is the kind of improvements that we've been able to see? We'll get out of the theoretical. You don't have to name names, but can you give us a case study example where we were able to help and we reduced their reliance on contingent labor by X% or whatnot? And once again, I'm not saying there isn't a place for contingent labor. I just think it should be planned for, not accidental.
No, you're exactly right, Elliot. There is a place for contingent labor, and there's a place for traveling labor, and there's a place for permanent labor. And the importance is understanding what is that mix. And I think, it's extremely important that you have to be willing to do a very detailed workforce analysis engagement that will let you drill down to the unit level of a system and understand what is the demand and what kind of talent do you need to supply to meet that demand. The challenge I've seen in many of our systems and with our clients is their willingness and ability to get to that data and let go of that data, because we all understand how everybody is protective about data these days, but you got to do that. But once you have that and can do that analysis, then you can understand what the percentages need to be of the makeup of your workforce, what percentages need to be contingent, what percentages need to be traveling, what percentages need to be permanent, because you mentioned cost, and it's about cost. And again, just pull up any news article today, and it's the cost of healthcare and the shortage of staff. But What our clients that are deploying this are doing to be successful, they're taking this analysis and they're looking at it through the lens of what is it costing me not to fill this job? Where traditionally the view has been, what is it costing me to fill this role? And that's how talent acquisition departments have been managed by finance is what is it costing you to fill these jobs? And we have to be able as TA experts to convert that into language and say, this is what it's going to cost you overall if you don't fill this job.
It's very easy to be able to demonstrate that. And, when we worked together, we did some work for life science companies, particularly helping them build and manage sales forces. And, we could always show the cost of vacancy based on territory volumes in a particular geography. What have you guys been able to do to be able to show that cost of vacancy, if you will? And you're right, everyone's obsessed with cost per hire. But, have you been able to build effective models for the systems showing the cost per vacancy? For example, if you have a hospital that needs 600 nurses to operate with, let's say, a 90% census, which is, a good census level. You don't want to be too high. You don't want to be at 100%, so you have a little capacity if you need it. But, let's say 90 to 95% census. Have you been able to show them what it costs to not have phlebotomists, not to have their therapists, not to have nursing staff available? You don't have to go into great detail here, but is that something you guys are capable of doing?
It is something we're capable of doing, and it's what you refer to when we work together. It's what we refer to as those Tier 2 and those Tier 3 metrics that are very hard to get to but are very valuable to an organization. Right now, the focus is on, it is a cost savings issue of this is what a traveler cost me, which is 5 times what a permanent hire cost me. So by just reducing your traveler count by 20 heads saves you $4 or $5 million a year in spend, which can more than cover the cost of bringing in an RPO program and doing this analysis and then some. So yes, we are capable of doing this, and that's what companies are going to have to do to have that conversation with the CFOs out there and with those CEOs to say, this is what's going to happen if we don't act.
Keith, you make a good point here, but I'm just curious, a lot of this modeling that you guys do is matter of course in your engagements. These large systems go out and they spend a fortune on strategic consultants like McKinsey or ones like PwC or Deloitte, and they do these large models. Of course, these organizations never fill a job. They just give them a report and leave. How often do you find that you come into a new client and they've spent a fortune on external consultants to do work that you just would normally do as part of your implementation process for AMN Healthcare?
Unfortunately, Elliot, we find it a lot. And that's one of the beautiful things about working with an organization like AMN is that consult to operate capability where it's seamless. It's not just that dropping of the report on the desk, collecting the check and walking away. And, in addition to that, a company like AMN, we focus on nothing but healthcare. As mentioned earlier, that's all we do. We live, eat, sleep, breathe healthcare, and we know it inside and out. And if an organization is considering a transformation, I would suggest very strongly whoever you're going to consult with is who you need to operate with.
All great points. So for the folks in our studio audience, workforce planning requires a lot of technology to do it right. And if you don't have that in-house and you find, once again, nothing wrong with travelers if you plan for it. It's those unplanned expenses in response to unanticipated spikes in needs that are the problem. So if you're an organization that has, issues with workforce planning, sometimes you can get help from a partner rather than having to get all that internal capital expenditure as a system. You're not going to get that funded. And you may be spending a lot of money on filling jobs, but you may actually be spending more money on not filling them. And that was a tremendous point you made, Keith, about the cost of the unfilled jobs. And finally, you might be spending a lot of money on consultants that an RPO, MSP, or other HR service partner would do as part of their analysis prior to their provision of service. So keep that in mind. Sometimes you want to be able to have one throat to choke. You don't want to be going to your RPO partner and saying, well, this is the report I got from, XYZ consulting firm. Use the data they actually gave to you. So all great points. Keith, thank you so much for taking part in the podcast.
Elliot, I enjoyed it, and always a pleasure to catch up with an old friend.
Absolutely, and I'll look forward to doing that again soon. I want to once again thank Keith Bradley, who's the president of RPO Solutions for AMN Healthcare. And once again, AMN is one of our most highly rated providers on the HRO Today Baker's Dozen, which was just released for 2022. And I want to thank all of you for your time, your attention, and we look forward to you joining us on the next HRO Today Educational Podcast.